January 2021. A hospital chain is bleeding out. Nurses are reusing gloves. Operating rooms are canceling surgeries. Patients are waiting 8 hours in emergency rooms that have run out of basic supplies. And somewhere over the Atlantic, on a 190-foot superyacht, the man who owns those hospitals is opening a bottle of champagne. His name is Dr. Ralph de la Torre. And this is what he just did to your hospital. He is a heart surgeon. He took an oath, then he took everything else. Steward Healthcare, 31 hospitals, 8 states. Your state, Massachusetts, Florida, Ohio, Pennsylvania, Arizona, Louisiana, Arkansas, Texas. If you've ever walked into an emergency room in one of those states, you were inside his machine. De la Torre founded Steward in 2010. He told the public he was saving struggling Catholic hospitals from closure, a physician hero riding in to rescue communities that Wall Street had abandoned. The press loved him. The politicians praised him. The patients trusted him. Here is what the bankruptcy court documents prove he was actually doing, while nurses went unpaid, while supply closets ran empty, while patients sat bleeding in understaffed ERs. De la Torre was engineering the most sophisticated hospital looting operation in American history. The mechanism was elegant. Criminal, but elegant. Step 1, buy the hospitals. Step 2, sell the real estate underneath them to a separate company called Medical Properties Trust. Step 3, make the hospitals pay rent to the landlord that just bought the floor they're standing on. The hospitals are now trapped, paying rent forever to a company that answers to investors, not patients. And the hundreds of millions generated from selling that real estate? Dividends, straight to De la Torre and his investors. Here is how the extraction machine actually worked and why you never saw it coming. Medical Properties Trust paid Steward over $1 billion for his hospital real estate. That money didn't go to new equipment, it didn't go to nurses, it went out. In January 2021, while Steward hospitals were already showing signs of critical deterioration, De la Torre approved a $111 million dividend payout to himself and his investors. $111 million. Out the door, while his nurses were reusing gloves. Then came the jets, 2 corporate aircraft valued at $95 million, a 190-foot super yacht worth $40 million, a $15 million sport fishing boat, a $6 million horse ranch outside Waxahachie, Texas, and the $10 million donation to build a science center at his children's private school paid for with Steward's money, then handed to a construction company where De la Torre held a 40% ownership stake. He was donating to himself with your hospital's money. The total extraction De la Torre and his private equity partner Cerberus Capital Management combined was approximately $1.3 billion, pulled directly out of the system meant to keep you alive. By 2023, federal regulators declared patients at Good Samaritan Medical Center in Brockton, Massachusetts were in immediate jeopardy. That is the highest patient safety alert the federal government can issue. The nurses had been warning officials since 2021. 2 years of warnings, ignored. Death rates for specific conditions at multiple Steward hospitals were rising, while identical death rates at hospitals across the rest of the country were holding steady or falling. This is not a tragic accident. This is not mismanagement. This is what the peer-reviewed science says happens when private equity acquires your hospital. Harvard Medical School, JAMA, the most prestigious medical journal in the world. They are finding private equity hospital acquisitions are associated with a 25% increase in hospital-acquired conditions, infections, falls, patient harm compared to hospitals not owned by private equity. 25%. Not a rounding error, not a statistical blip, a 1 in 4 spike in the chances that walking into a hospital like De la Torre's gets you sicker than when you walked in. A 27% increase in falls, a 38% increase in infections from central lines, the IV inserted near your heart, And a follow-up study in the Annals of Internal Medicine found private equity hospital ownership associated with increased mortality in emergency departments. The mechanism? Staffing cuts. Always the staffing cuts. Because while De La Torre was buying yachts, his hospitals reduced emergency department salary spending by 18%. 18% fewer dollars spent keeping your ER staffed. More than half of Steward-owned hospitals ranked in the bottom half of acute care hospitals nationwide for patient outcomes. Many ranked in the bottom quartile. From 2014 to 2024, Steward closed 8 hospitals across 4 states. Over 1,500 patient beds gone. Over 4,400 jobs for nurses, doctors, and staff. Gone. The 6th of May 2024. Steward Healthcare files for Chapter 11 bankruptcy. $9.2 billion in debt. The largest healthcare provider bankruptcy in American history. 5 hospitals closed permanently. Rockledge Hospital in Florida shuts its doors, leaving over 60,000 people without an emergency room. Gone. Overnight. Just gone. Roughly 5,000 workers displaced across 8 states. Not abstract numbers. Real nurses, real orderlies, real people. The Senate Help Committee issues a subpoena. They want De La Torre to testify under oath about what happened to his hospitals and why his patients are now driving past closed emergency rooms. He says no. A physician, a CEO, subpoenaed by the United States Senate, and he says no. The 12th of September 2024. The Senate hearing begins. The chair's seat sits empty. De La Torre's chair, empty. The 25th of September 2024. The full United States Senate votes unanimously, every single senator, both parties, to hold Dr. Ralph De La Torre in criminal contempt of Congress. The first unanimous criminal contempt vote by the full Senate in more than 50 years. The last time the Senate did this, Richard Nixon was in the White House. And what did De La Torre do the week before that vote? He sued the senators, he sued the people trying to hold him accountable for the hospitals he destroyed. Then, he came back from a Caribbean scuba vacation, and federal agents were waiting. They served him a search warrant. They seized his phone. The bankruptcy trustee then filed a lawsuit against him seeking $3.4 billion. His own company, suing him for what it calls his greed and bad faith misconduct. The complaint uses one word to describe what he did to his hospitals. Pilfered. This is not a broken system. This is the system working exactly as Ralph De La Torre designed it. He didn't stumble into this. He built it. One sale-leaseback deal at a time. One dividend at a time. One understaffed ER at a time. He was a heart surgeon. He knew what a failing hospital looked like from the inside. He knew what happens to patients when the nurses disappear and the supply rooms go dark. He knew. And he kept going. Today, 5 of his hospitals are permanently closed. Thousands of his workers are still looking for jobs. Families in Rockledge, Florida still drive 40 minutes to reach an emergency room. And the victims of Steward's abuse and neglect, the patients and families who filed over $344 million in claims. The bankruptcy trustee says they may get nothing. Nothing. While De La Torre's yacht sits in the water, the Department of Justice has been asked twice to prosecute him. The SEC has been asked to investigate. Federal agents have seized his phone. As of today, he has not been charged with a single crime. He is not in a prison cell. He is not in a courtroom. He is at a horse show. Dr. Ralph De La Torre, former CEO of Steward Healthcare, currently under federal investigation, currently held in criminal contempt by the United States Senate, currently being sued by his own company for $3.4 billion, and currently free.